5 silent killers. These are the 5 killers that my staff identified. Some of you have experienced some of these things, and hopefully not all of these things, but chronic kidney disease, hyperthyroid disease, diabetes mellitus, cardiac disease, and cancer. Cardiac disease, heart. Obviously, when we do a physical exam, we hear heart murmur, but oftentimes in cats you don't hear heart murmur. Sometimes you'll hear an abnormal heart rhythm, but oftentimes in cats you don't. Sometimes you'll have a racing heart. Sometimes you'll see them collapse or pass out. This one's probably more often something that we see, and you kind of have to separate, is this because of heart or is this because of primary lung disease? So we'll often see that. Rarely do we see blue gums, but you can. Boy, if you bring a cat in that's open mouth breathing, they're in trouble. Cats just won't open mouth breathe. So if you get to that stage, if you see you get up and your cat is open mouth breathing, get them in right now. Acute or sudden paralysis, especially in the rear limbs, that's a specific disease. The cold limbs, that's part of that. I'll talk about that in a minute. Sudden pain, again, that's all kind of set up together, or lameness, and sometimes they just die. Sometimes they look at you and they just lay over. And some of that is because they're so good at hiding their disease. But there are a few conditions where they'll throw blood clots and suddenly die. And that's what this one is. These are about, because a heart disease can, because the blood flow through the heart is not going in a nice smooth pattern, it's swirling. And when blood swirls, there is a possibility of forming a clot. And the places where the clots will lodge is at the bottom of the aorta, where it splits out to the 2 legs. And if the clot's big enough, it can block one of those major vessels down to your leg. And now the leg is tingling. They are very painful conditions. We have been able to do a little bit more now that we have the laser to bring some of these guys back, but there was a time in my career that I looked at you and said, if you love your cat, you're going to use the euthanize, because this is excruciating. And now with pain medications and some laser therapy and some anti-clot type therapy, we are able to bring some of these guys back, and then we do therapy to try to prevent the clot from coming again. So we've moved along in this disease, in these diseases. This is Ramses. He's a 9-year-old Sphinx. And it's a little hard to see because he turns white here, but they brought him in because he looked like he was growing in the belly. And he was. We took an x-ray, and this is all fluid. And that's because the heart's not pushing the water through, the blood through the heart efficiently, and so blood is waiting to go through the heart, and when blood waits, fluid leaks out. And so this was all fluid, and his particular condition, this is why we don't always hear something, is that this is the wall of a normal heart, and in these cats called hypertrophic, hyper, too much, trophic is building, so too much building. These walls get thick inwardly. People do this too, and most of these people are in heart transplant lists. And so these chambers are smaller, you can't get as much blood through, and the heart isn't as elastic, so it can't beat as efficiently. And so blood waits to get through that heart, and it accumulates. Often these teeth are related to some of that, because that bacteria is being picked up in the bloodstream and taken around. Where does it go first? It goes back to heart, and you can cause some bacterial damage on these valves, cause some radical damage on these muscles. And always the only answer to that, but one of the things we use in these guys is anti-radical therapy. We can watch the heart with ultrasound. You can see we're looking at the heart here, and I put that picture on because ultrasound is so non-invasive that, it's pretty easy to do those guys, and it doesn't take anesthesia or anything. They just sit there and we love on them and they look at the heart. So the treatment plan in Ramses was to reduce the preload. We didn't want water to be sitting around waiting to go through, or blood waiting to go through. So we didn't want as much water in the blood, so we just used Lasix, anti-radical vitamins, and we drained the fluid out of his belly. And we had to go in to drain fluid out of his belly for about every 10 days or so. And he survived for about 3 more months. So not a good one. And we could have instituted, if we can catch these early, we can institute some of the antiradical and some of the preload stuff to take away some of the challenges in this. But this is really not a good disease, and we don't win this one ultimately. We don't really know what bottom line why some of these guys have hypertrophic cardiomyopathy.